So I am planning on doing a continuation of a series that I've been doing on natural treatment of psychological disorders. We've been talking about a lot of different things as far as natural treatment approaches go, but this would be the fourth in the series related to psychological disorders. And our previous shows talked about several subjects, including depression, bipolar disorder, schizophrenia, and now I'm going to go ahead on with discussing OCD, which means obsessive compulsive disorder. There's I thought it was a good movie out quite a few years ago called As Good as It Gets with Jack Nicholson. You may be familiar with that movie. Mm-hmm. But it was a good illustration of OCD in terms of the level of its involvement in Jack Nicholson's life, whatever the character's name was, and how pervasive it is in someone's life. OCD is, generally speaking, would be classified as an anxiety disorder, if we look at it in more general terms. But one of the problems that people with OCD have is that they are so detail-oriented that they get caught up in the details and can't break themselves away from the details to a certain extent. So with Jack Nicholson, some of the scenes showed him locking the door, for example. He would lock one lock, lock another lock. He would count the number of times he locked the door, and if he got off on his count, he'd have to redo it. So he'd start over again, locking the door and locking the locks in a certain sequence, whatever it meant to him in his mind. It had to be a certain sequence or things wouldn't work. Okay, that's an example. The hand washing, he would wash his hands a certain way and he would go on and on and on and wash and wash and wash and wash. There's a scene where he is taking a shower and I forget the name of the actress that plays alongside him there, but he's going out on a date with this lady and she's waiting for him while he takes a quick shower, right? And it's like an hour and a half long, at least. She's sitting there waiting and waiting and waiting. And this guy's taking this very, meticulous shower. And this kind of scenario leads to indicates the signs and symptoms of obsessive compulsive disorder. Mm-hmm. So we have this obsession with certain types of things, and cleanliness is a common one. Also, just different kinds of detail can be a part of this. Like, for example, you may find yourself before you leave the house, if you've been, say, some of the possible reasons for these things, like, say you were in a house fire, right? Or if you had a fire at some point in time in your house, maybe as a kid, you might tend to fear a repeat, and therefore you might, anytime you needed to leave the house, check the stove, right? Then you might get to the door and say, did I check the stove? Right? Mm-hmm. That kind of second guessing. Okay, and then go back and check it again. And, to do it once and recheck, that's not the level of what we're talking about here. We're talking about like going back and checking and rechecking and maybe even turning the knobs over and over again and making sure they're lined up right in the center, to the off position, and rechecking that and making sure every one of them is in the off position, and maybe going back and visually checking, are they all in the off position? And okay, if I look at them another way, are they all in the opposite? This kind of obsession with that specific detail is a facet of OCD. And, you know, we can go on with lots of examples of these kinds of things. So we have the cleanliness, the hand washing, the very, very long showers, the checking the stove, checking the burners, checking the door, locking the door many, many times over, these kinds of things. It's the detail and it's fear. It's anxiety, basically. Okay, anxiety over these specific details that is very incipient in somebody's life. Like, okay, another example from the movie was this lady went to his door, right? This very religious lady who asked him to walk the dog of his neighbor who had been beaten up, actually, right? He was attacked and he was very ill from it and needed to repair and recover. So the person that was helping that neighbor out with bookkeeping, daily stuff, these types of things, went to the door of Jack Nicholson's apartment and asked him to watch the neighbor's dog. And to her surprise, he said he would do it. And therefore, you know, this lady reacts with a lot of thanking and a lot of praising, right? And tells him something along the lines of, you know, he's a magnificent person and that God is going to do wonderful things for him and all these kinds of things. And then he just very in a targeted and insulting way responds to her, you know, telling her to get back on whatever bus brought her crazy ass into his door, sort of thing, right? This kind of thing. And basically insults her religion, insults her as a person, etc. Because of his focus on specific details, or at least related to that, he has a certain very well delineated point of view on that and can't part from that to even be polite. So there are times when this kind of individual might have issues in social circumstances. Okay, so we have all sorts of these kinds of things going on. So it can be very isolated in its fashion, or if they're in a social environment, it can be really problematic.
Is this all a mental issue, or is there physiological items that go with that?
Right.
It's
and
a question.
That's the premise. Emery is asking if it's all physical, or is it all psychological, or is there an underlying physical reason? Yeah. So that's really the premise of what I've been exploring here is natural treatment of psychological disorders, right? Looking at physiological underlying factors that may be causing and or influencing these disorders. Okay. And that's what we're doing here. So we're exploring these kinds of things. Now let me give you a few more examples. Okay. So people who are are very organized, as some people who are extremely organized and extremely detailed about their organization will need things in a certain way. Like, for example, people who walk into a room and notice all the pictures that aren't straight and are compelled, this is the compulsive part, are compelled to straighten those pictures out, right? So you have obsession over certain details and then this compulsion to do something about it, perhaps. And so that would be the picture hanging, you know, person who has to straighten out every frame in the room, or maybe has to have books lined up a certain way or in a certain order, or has to have everything on their desk in a specific, very well ordered setup. You know, maybe alphabetical, maybe. Good. So, you know, these kinds of things are other characteristics of obsessive compulsive disorder. Does everybody have to have all of them? No, to be diagnosed that way. But all of these can be facets of the disorder. Okay. So related to that, you know, in conventional medicine, certain drugs are used, sometimes SSRIs. One commonly prescribed is called fluvoxamine or Luvox. And fluvoxamine, basically it's helping to increase serotonin, make somebody feel a little better, so maybe they can retrain, this kind of thing. And there may be some good to that approach at times, because it gives the individual a chance to kind of take another look at how they're being, you know, and maybe try different behaviors or learn different behaviors. However, there are natural approaches that can be equivalent and don't cause any sort of drug reaction, which sometimes SSRIs can become addictive. You can have trouble getting off of them, this kind of thing. And they do change the brain chemistry. So there are studies showing that one alternative possibility for the use of Luvox or fluvoxamine is the use of IP6, which is inositol hexaphosphate. Inositol. Inositol is a B vitamin, often coupled with choline as well. Choline and inositol are very important for brain chemistry. Choline is very important for memory, for example, and it's important for brain activity. In fact, one of the major neurotransmitters is rooted in choline. It's acetylcholine. And, you know, in brain chemistry, the neurotransmitter acetylcholine is important for memory and cognition. So thinking and memories. And you can see how thinking and memories, or thoughts and memories, could be part of this kind of anxiety disorder. You know, if somebody has bad memories, like I mentioned, having had a house fire and then checking the stove all the time, this kind of thing. Or maybe they had a book that, I don't know, they lost papers in or something, who knows. But so the chemistry involved in the brain chemistry can be affected by natural nutritional substances. And this is the example with acetylcholine. We have, as a neurotransmitter, a major neurotransmitter, at the root of that, the B vitamin choline, which is spelled CHOLINE, if you'd like to look it up. And this can be converted back and forth between serine and choline, which are both involved in the cell structure and somewhat in the cell membrane. So, for example, there are nutrients such as phosphatidylcholine and phosphatidylserine that can be converted within the body. All right. And then we can look at the first part of that, the prefix, which is the acetyl part of the acetylcholine combination. And we have acetyl, so an acetyl radical, which is also a component in many, many different substances. One of those being N-acetylcysteine, which is also helpful for liver function. So one possibility is to combine, say, N-acetylcysteine and phosphatidylserine or phosphatidylcholine. So you have the acetyl part and the choline part. And this provides the raw material or the underlying chemistry to create acetylcholine. So why am I bringing all this up? Well, I'm getting off track from OCD a little bit here, really thinking more about things like Alzheimer's. You know, with Alzheimer's, one of the treatments is the use of Aricept. Aricept is basically a drug that inhibits an enzyme, a certain enzyme that breaks down the acetylcholine neurotransmitter and causes your body to reabsorb it. So what we have is acetylcholine esterase is that enzyme eating up the acetylcholine. So what happens is when we have neurotransmission and we have these thoughts and then there's leftover acetylcholine, the body resorbs it, right? Very similar to what happens with SSRIs. Now I'm getting really complicated. I'm going on to more of them, but let's just stop there. So with acetylcholine and acetylcholine esterase, we have the resorption of acetylcholine. So an acetylcholine esterase inhibitor inhibits the acetylcholine from being broken down by the enzyme. So basically it inhibits the enzyme action that breaks down that acetylcholine, which means that you have more acetylcholine left over still available for the use by the brain. Does that make sense? Okay, so let me stop there because let's absorb that a little bit, and then I'll go back to talking a little bit more about the brain chemistry and what's going on with nutrition versus drugs. Okay, so you've been listening to A Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting. And if you'd like to get a hold of us at the practice, you can always call us in the U.S., certainly at 727-329-9637, or I believe the code is 01 for overseas if you want to give us a call if you're going to travel to Florida and you want to come see us. But the website is www.aptw.net. That's short for A Path to Wellness. And you can always take a look at our site and figure out all the things we do at A Path to Wellness. And we'll talk more about OCD and brain chemistry and nutrition and all that good stuff after the break. I think the As Good as It Gets movie is a real good example. It's an amazing movie too. And I should mention that they can access. Okay, so I should mention that they can access online the magazine with my articles on these things as well, which can be accessed at tampabaywellness.com. So we'll go back into that after the break as well. My throat needs a break.
We have 1 minute and 47 seconds as your producer.
Okay.
Do you want water? I'll get you some.
You have some?
Once you start, I'll go get it. Is that okay?
Sure. Yeah.
Put it in there.
Sure. My barista.
Your own personal barista. You deserve it because today, and don't forget to mention, I was going to ask a question. Let me turn this on. I was going to ask a question for, since this show is going to air on Friday on Fab Radio International at 10 a.m. Eastern Standard Time.
Oh, at 10 a.m. Eastern.
Yes, because the UK has 5 hours of difference, so it's 3 p.m. their time.
Mm-hmm.
And the question is, some of the terminology, the scientific terminology that you're talking about for the brain, or it's the same lingo in the UK, right?
Yes.
Okay, perfect.
Yeah,
Because we, now you'll be talking to your fellow British people.
sure. Maybe I should throw in a British accent.
You're French background, aren't you?
Well, no, I got a little French in there, but the British is more of my father's
Oh, really?
side.
Oh, really cool. So you're back to your roots.
Something like that.
Starting in Manchester, UK. How cool is that?
Yeah.
So we are going back. About to start up again.
Welcome back. You're listening to Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting. And I guess I can mention the Fab Radio International folks, and you'll be listening to us in Manchester, and shoot, they're listening all over the place, right? So
All around the world.
yeah, truly. So welcome to the show, regardless. And I hope you're finding it interesting. So I should mention also that since the folks in Manchester are just starting to pick this show up on Fridays, that the topics of the shows that we did the last few times regarding the natural treatment of psychological disorders are written about. In fact, I wrote the articles in a magazine known as Tampa Bay Wellness Magazine. And you can take a look at those articles if you'd like by looking at the recent issues from, well, I had some other articles, other topics, but you can go back to May if you like. You'll see some other topics as well, like on men's health and weight loss and xenoestrogens and things like that. But we also have the natural treatment of psychological disorders that you can view in these magazines that I've written these articles on. And that's at tampabaywellness.com. You can hit that site and take a look at those articles if you want to. Or you can wait for the podcasts to be up as well, if you like. But certainly you can access those immediately and read them if you'd like. So what we're talking about today is OCD. And that, again, stands for obsessive compulsive disorder. And we were talking about the brain chemistry a little bit, but inositol is also an effective part of this. So we have choline, very important to brain chemistry, as well as inositol. And inositol is another B vitamin. Well, studies have shown that inositol at certain effective doses has been as effective as treatment with fluvoxamine, which I mentioned earlier, or Luvox, known as well. So, am I prescribing something for anybody? No. Okay, let's go back to that. So, we're not trying to treat, cure, or prevent disease on this show. I'm not prescribing anything to anyone. What I'm trying to do is give information on some of the things that are not discussed a lot, certainly in conventional realm, in conventional medicine. You know, the use of the drugs that, say, control certain aspects of brain function or these kinds of things is wide. You know, it's a conventional approach. And getting to the root of these psychological disorders by looking at the biochemistry involved and nutritional makeup or nutritional balancing, and getting the nutritional components that are needed within the body to move the body back to homeostasis or back to a balanced state is the approach that I'm looking at. And a term that has been used for the kind of studies that I'm referencing and the kind of studying and research that I'm doing as well in this area is orthomolecular psychiatry. Okay, so, you know, in my practice, I do holistic medicine. I look at natural approaches to treatment of all sorts of disorders, right? From hormonal endocrine to, you know, diabetes to heart disease to many different things. Well, this gets into the realm of the psychological and behavioral medicine. And although that has been part of my practice in the sense that when I see an individual for the physiological disorders, often there is also a psychological or behavioral issue that needs addressing and may actually be related to that physiological issue. So I felt the need to do further research and to do further studying in this area to properly address that as opposed to just in a cursory fashion. So I'm digging for more answers, basically, to understand my focus and the focus of my practice, which is on the underlying cause. So that's what we're focused on. And so that's what we're addressing here is the underlying cause, or at least the underlying issues that may be happening within the body as a result of a disorder, or the disorder may be as a result of those issues. So that has to do with balancing. So with the natural treatment of OCD, obsessive compulsive disorder, there are several approaches that can be taken, and I've already mentioned one of those, which is inositol, or even IP6 inositol hexaphosphate. Okay. Non-compliance is a big issue for patients that are prescribed antipsychotics, and that's a very common issue is the non-compliance. I've talked about this in my articles as well, and we want to help these issues. Well, some of these drugs that are prescribed for psychological disorders have serious effects on blood, specifically on white blood cells. You can see a diminishment of the levels of white blood cells, which means that they can affect immune function. And I at least have a concern that when an individual is going to a 15-minute visit with his psychiatrist and is prescribed these drugs and is on them long term, that maybe there might not be enough follow-up, and therefore there can be life-threatening consequences if there's not enough tracking going on, leading to disorders like agranulocytosis, which results from this kind of situation with the white blood cells. So if we can find a more natural approach to these disorders, then we may be able to actually have people be more compliant, which means that we have people who are treated for these disorders in a way that they will stick with. So that's another motivation behind this, to deal with these non-compliant patients. Many physicians have difficulty bridging that gap, can't do a lot about that because they're so much focused on the use of the drugs. And I know that around the world there are more integrative practices. And this is kind of what I've been promoting for about a decade in this country, is to see more integration of the natural and the pharmaceutical approaches so that we find the best approach for each individual patient, which is what this is supposed to be about, right? I'm getting applause in the audience.
Yep.
Thank you. So that's another motivator for this kind of discussion. And, I think it's a more humanitarian goal to find alternatives that people will stick with and that will be helpful to their health, which, is kind of the opposite when we look at some of these antipsychotics. So, I want to explore that as well. Okay. Let's see. So, speaking of OCD, back to OCD specifically. So, we've this is the fourth in my series on psychological disorders, as I mentioned.
You
And
know, OCD. Not to
maybe
be,
I'm repeating, huh?
No.
I'm going back to it over and over again.
OCD.
There's a
Not
term
to be
for that,
not to be confused with ADD.
for sure. Yeah. You know, maybe that'll be the topic of another show. Maybe I should get into that.
Absolutely.
Maybe I'll write an article on that too.
Absolutely. For all the
ADD,
amazing
ADHD.
artists, I call it artist distraction disorder.
Oh,
For all
okay.
our wonderful art community.
So losing focus with all the distractions.
Yep, so that's why I just took you out. That's what I do. Back to
Mhm.
OCD.
Okay. So back to OCD. That's right. There are issues related to the anxiety, okay, and the treatment of anxiety that we can get into. For example, if somebody is low in B vitamins, that can often be related to anxiety issues. Again, that can happen if people, which is it's actually fairly common, and being low in B12 leads to that kind of situation. But it also can lead to anxiety. Anxiety disorder, we unsure, things like that. It can also lead to social anxiety, these kinds of things. So B vitamins are very important in terms of balancing our body's functions, help absorb iron, important for energy, important for adrenal function, supportive adrenal glands, which are very important to our fight or flight response. It relates directly to anxiety. Okay, so the fight or flight response relates to, kind of this scenario when we're hunter-gatherer beings and we were out in the woods, ran across a bear, for example. It's fight. Do you stand and fight the bear, or do you take off? Fight or flight. So our bodies respond to this of modern life. And stress is a huge topic. Is directly affecting our biology on a daily, hourly, minute by minute basis. And it may be a lot of cases these anxiety disorders relate to a difficulty with coping with stress. Okay? And this is the fight or flight response. So with OCD, there can be some overlapping with other disorders, like, for example, treatment of depression. Well, there's a substance that's shown efficacy with treatment of depression, really widely known substance, the extract of which is person, but basically is St. John's wort. I think there's another name in the British realm. It's St. Mary's, I believe. But no, I'm thinking of another herb, I believe. Anyway, St. John's wort, we'll call it that now. So it has shown efficacy in studies that compared St. John's wort at 900 grams per day to standard SSRI treatment, that is selective serotonin reuptake inhibitors like Prozac, paroxetine, fluoxetine, etc. Okay, so that would be comparing it to a 20 milligram dosage of each, for example. The result was a 57% decrease in OCD symptoms compared to paroxetine, okay, and a 48% reduction compared to fluoxetine, so, which I believe is the Prozac. So we have evidence that the natural substances can be just as effective at treating disorders like OCD and depression. There's some indication that the pathophysiology of OCD may be rooted in oxidative stress. So we talk about stress, we talk about fight or flight. This is what I was getting at. The extent of oxidative damage was actually detected using a certain kind of drug. I won't get into that, but this particular one shows when there is lipid peroxidation. Okay, so results from cell membrane lipid peroxidation. Okay, so what that means is the breakdown of the fats in the cell membranes, which is a kind of oxidation reaction that's happening there. Okay. To put it in English. Okay. Or maybe, I don't know if the Brits consider that English. How about that? Layman's terms. I like that better. So the study demonstrated that antioxidant levels for participants with OCD were lower than controls, okay, and that oxidative cell damage was higher with statistical significance as indicated by the level of this particular chemical in the cells, okay. And additionally, there was some significance seen in treatment with vitamins C and E. So, in other words, we can help this situation by boosting C and E. And then we look at antioxidants that are part of that same list, the major ones, which are vitamins A, C, and E. Okay, those can be very helpful. And particularly with lipids, vitamin E is an important one because it helps to, it's an antioxidant specifically for the breakdown of the fats in the cell membranes. Okay, so that's another example. So vitamins A, C, E, and lots of other antioxidants are suggested in the treatment of OCD by these studies. Additional relevant antioxidants aside from ACE include glutathione, superoxide dismutase, and possibly even some others. So I did mention inositol also is a B vitamin, right? I mentioned the B vitamins, B12 specifically. Well, if you just get yourself on a B complex, if you have issues like this, get on a B complex, right? Then you're going to be helping in a way that I'm not giving you any doses or anything. I'm just saying that B vitamins are helpful in this kind of functionality. And so are the antioxidants, A, C, and E, okay? And I'm biased toward others, like selenium is important in glutathione peroxidase production, these kinds of things. So selenium is a very powerful antioxidant as well. That is a mineral. However, you've got to be careful about going too high with selenium. There are some issues with that. But there is a lot of debate also about what too high is. So
issues as in
physiological issues that can occur if you get too high in the dosage.
Can you give an example?
Well, for example, you can affect the breakdown of thyroid hormone by having too much selenium. There's an enzyme that is active in breakdown of thyroid hormone from free T4 or T4 to T3, which is two major thyroid hormones, the active one being T3. So involved in that breakdown, there are selenoenzymes that help with that breakdown in your thyroid. So if you're breaking down too much of it, you can have levels that are too high and really move toward hyperthyroidism or thyrotoxicosis.
So we go back to that principle of, and that's something that you treat, where you can be taking something here for one thing, but could be creating an issue somewhere else.
Right. This is why you need somebody who knows how to balance all this, right? So, and you know, I often hear this statement, you know, I tried this or I tried that and it didn't work or whatever, right? And that means that somebody quite often has not used the right dosage for themselves, right? And also there are many parts of that situation that need to be considered when treating an individual. How are other things going on physiologically going to affect the result? So I'm going to take another break. My throat's getting a little dry here. And you're listening to A Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting. And we'll talk to you after the break some more about OCD and other kinds of things, psychological.
I forgot to get you your water. I'm so sorry.
I'll walk over and get up from that.
When I heard your voice going, I thought, he needs water. I'm like, oh my gosh, I didn't get it. So you're doing really good. Yes.
So starting off
Absolutely. This is step 4.
go ahead, so bathroom. So
Okay, great.
it's definitely a limit.
Billy Page's mix.
You should check out the new format. I don't think you've seen it on the website.
Okay, you ready to go? 12:46. Well, we have one more minute. I'll let them finish this song.
Okay.
And I'm gonna put the camera back on. Which the other, everything's on this. It's Kristen Graves, musician. The song was Dear Mister.
Welcome back. My voice is back. So here we go again. All right. So we were talking about obsessive compulsive disorder and some of the methods we can use naturally to treat individuals with obsessive compulsive disorder. And this is just, everything I'm talking about is based on research. I don't make these things up. Okay. This is all referencing research that has shown results. And I mentioned the research on IP6, or inositol hexaphosphate, and its equivalence in effectiveness at certain dosage levels to fluvoxamine, Luvox, for OCD. Well, there are others, many others, and we talked also about B vitamins and St. John's wort. Well, in addition to that, just like with other disorders, including other anxiety disorders such as generalized anxiety disorder and social anxiety disorder, improvement is seen for OCD when serotonin levels are elevated, leading again to the application of SSRIs, but also in the more natural approach, serotonin can be increased or stimulated to be increased by a precursor known as, it's an amino acid known as tryptophan. A lot of people have heard of tryptophan. It's in many dairy products. Some people like their warm milk to go to bed at night. That's the tryptophan helping them to fall asleep. It's important to the production of melatonin as well as serotonin. Melatonin is that hormone-like substance that is produced by the little gland inside your brain called the pineal gland that also is shutting down production of melatonin when the sun comes up, this kind of thing. So it helps us regulate our sleep patterns and our circadian rhythm. Serotonin is present not only in the brain, where there's about 5% of what's in your body is in your brain, and actually about 95% is in your gut. So there is a definite connection between gut and mood because of the level of serotonin that's actually produced inside your digestive tract. And other helpful substances that can help to improve the levels of serotonin include magnesium. So magnesium can help your body stimulate the production of serotonin to ease the symptoms of OCD. Now, selective serotonin reuptake inhibitors are treatments that are of marginal assistance to only 40 to 60% of OCD patients. This is what's been shown in the research. And then we have the side effects of SSRIs, which can include things like suicidal ideation. So you want to, it's something to consider If you take these SSRIs sometimes, especially with younger humans, like teenagers and so on, there's been some history of suicide. And then there is the fact that there's a certain level of dependency that occurs with them. So the limited efficacy of SSRIs may indicate that the application of tryptophan to stimulate the elevation of serotonin, as well as the similar application of magnesium, may be helpful, although it still may not be the best approach. So we have to kind of balance all of it together. So really a multilateral approach, you could say, might be a better approach, where you bring in B vitamins, you bring in tryptophan, or 5-HTP is another form, through that conversion process to serotonin. But that combined with magnesium has a relaxing effect. It's specifically relaxing right at the synapses. So right at the neuron level, you see a relaxation effect. Whereas its sister nutrient or mineral, calcium, is the opposite. It's more excitatory. So you can see a relaxing effect with magnesium, which can help with the production of serotonin as well. So this combination, and you might even want to include some St. John's wort. It depends on the individual and their circumstances, especially if there's some depression involved as well. So you see how this kind of balancing act is brought in, and it needs to be done in a fashion that works with the individual and helps, in a lot of cases, in looking at things holistically, with many other issues going on with that individual. Like if they're low in B vitamins, if they're low in B12, that can affect iron absorption, it can affect energy level, it can affect muscle strength, it can affect your heart. Okay, the same with magnesium, very important to the heart. So some of these nutrients might be specifically of more importance in some individuals if they have, in addition to this disorder, OCD, other issues going on cardiovascularly, for example, and others. So, if they have weakened muscles, etc. So everyone's an individual, and the approach we take at A Path to Wellness is holistic, totally. So we're looking at the individual person and customizing what we're doing to treat that individual. So the combination that I come up with when I'm treating an individual in my practice, or in our practice, actually, it's more than just me, is to look at the individual as a whole, look at all of the issues going on, see what commonality there is, and find particularly those substances that are in common that would benefit that individual, that can help everything at once. And there may be some tweaking as we go along, but this is initially how I try to start things, so that we're targeting all of these intermingling and interreacting issues to help bring the individual more into balance, to target homeostasis. So that's just a little philosophical segue there, but that's basically the approach that I'm taking when I'm dealing with these kinds of situations. And as I said, dual diagnosis is a common thing. Looking at people with psychological or behavioral disorders at the same time as having physiological disorders. And there can be dual diagnosis beyond that. And maybe really it's more like triple diagnosis when you have a behavioral or psychological disorder combined with maybe alcoholism or drug use, or drug dependency, which is actually fairly common because of the use of prescription drugs, largely, especially pain medicines, and then in combination with the physiological disorders that can be present. So it's not just treating one thing unless that individual only has one thing going on that's a problem. You know, then we might target just that one thing. But typically, we all have something going on. You know, there may be several little things that are not optimal, and I am looking at optimal function, not just normal function. That's another differential there. So our practice philosophy is focusing on the cause, underlying cause, but also we're looking at things holistically, looking at the individual and everything going on and trying to tie it all together and figure out how we can best approach wellness and health, true health, by targeting all of the interrelating issues, and then if there are other peripheral issues, then that too. And it's not about treating the symptoms, it's about treating the underlying causal factors involved in the disorder. Okay, so again, that's what we're all about at A Path to Wellness. If you'd like to get in touch with us, you can take a look at our website, which is www.aptw.net. You can give us a call if you like at, in the US, 727-329-9637. You can take a look at the magazine articles that have been published by yours truly the last 6 months or so on TampaBayWellness.com, which is Tampa Bay Wellness Magazine. And I'm contemplating this subject that Anne-Marie brought up about ADD and ADHD for next week. But there may be some others that I might get into as well. I think it'll be interesting regardless.
If anybody has any questions for you to answer on the show, how can they reach you? On Facebook? Do you have a Facebook page?
We do have a Facebook page. You can just look up A Path to Wellness.
And what's your email address?
Or A Path to Wellness LLC on Facebook, and you'll see us pop up. And if you'd like to give us an email right at the moment, we're using this email, livinghealthy1@verizon.net. You can use that to send us a note. Let us know you're listening to the radio show.
And questions at the moment.
And any questions you might post, you might want us to answer on the show next time, or you know, you can always call in, right? And what is that number, Anne-Marie?
It's 7677.
So let's say that one more time
All right.
for the call in.
I'm sorry. Okay, here we go. 727
727
873
873
7627.
7627.
That's only on Thursdays between
Thursday,
the times
between
noon and 1
Right.
Eastern Standard Time.
For this show. That's
Correct.
right. Call in on this show. And something else popped in my mind and then went right back away. So I don't know what I was thinking there. But anyway, that hopefully was an interesting show for you. And we will talk about many, many more interesting topics in the future on A Path to Wellness and on rhinoonair.com, WSPF-DB.com. Take care.